Gender Minorities Aotearoa, Discrimination and Disparity. In this presentation, we're going to take a look at some examples of discrimination and disparity. We'll explore some hard facts about stigma, discrimination, and violence. This part will be unpleasant, and we'll touch on some traumatic topics, including sexual violence and suicide. But it will help us understand what life is like for transgender people in Aotearoa. So let's get started. Inequities. Prejudice against trans people results in extremely high levels of discrimination and violence. Discrimination and violence create disproportionately negative health outcomes, including high levels of psychological distress, self-harm, and suicidal ideation. It's not being transgender, but the inequities in the social environment that create these negative outcomes. The Ministry of Health New Zealand says social, cultural, and economic factors are the main determinants of health. When a flower doesn't bloom, you change the environment, not the flower. Social determinants of health. The social determinants of health, or SDH, are the central factors in the well-being of any population. They have a direct positive or negative impact on a person's health, enable or restrict people from having healthy options, and make it easier or harder to access healthcare. They have an enormous impact on well-being. So what are the social determinants of health? The World Health Organization said the social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. The social determinants have an important influence on health inequities, the unfair and avoidable differences in health status seen within and between countries. In countries at all levels of income, health and illness follow a social gradient. The lower the socio-economic position, the worse the health. The following list provides examples of the social determinants of health, which can influence health equity in positive and negative ways. Income and social protection, education, unemployment and job insecurity, working life conditions, food insecurity, housing, basic amenities and the environment, early childhood development, social inclusion and non-discrimination, structural conflict, access to affordable health services of a decent quality. So that list is from the World Health Organization. So what do the social determinants of health and the social gradient look like for trans people in Aotearoa? Discrimination. Trans people experience high levels of discrimination across all areas of public life: education, employment, housing, healthcare, justice, access to goods and services, social and recreational pursuits, policy and legislative input. This is especially so for disabled trans people and ethnic minorities. 67% of trans people experience high levels of discrimination, and 44% experience this in the last 12 months, compared with the general population, which the rate is 17%. Those who experienced discrimination in the past 12 months were twice as likely to attempt suicide as those who didn't experience discrimination. Employment discrimination. The median income of trans people is just half the median income of the general population. The rate of unemployment for trans people is 11%, more than double the national average of 5%. More than a quarter of trans people say that being trans makes it harder for them to get paid work. Poverty. Trans populations experience higher rates of poverty and poverty-related health disparity than the general population. 51% have gone without fresh fruit or vegetables in order to reduce costs, and 64% put up with feeling cold. These figures are 3 times the rate of the general population. Poverty often results in limited material means to arrange and keep GP appointments, have stable housing, access food, transport, work, and wellness. Many crimes are poverty-related, placing trans people at a higher risk of being a victim of a crime or committing a crime and being punished. Incarceration rates are also higher for trans people. Education and student experiences. Trans people are invisible in curriculum. Even sex education does not include trans people's existence. These issues may prevent trans people from staying in school and gaining qualifications. 23% of trans students are bullied at least weekly, compared with 5% of cisgender students. Only 14% of transgender students participate in sports, compared with 26% of the general population. 55% of students are unable to access healthcare when they need it, compared with 19% of cisgender students. Housing. 1 in 4 non-European trans people experienced homelessness at some point in their life. 1 in 5 trans people experience this overall. 72% of homeless trans people first experienced homelessness as a teenager. 71% of homeless trans people moved at least once every 6 months on average in the last 5 years. 82% of homeless trans people said transphobia from housemates was a factor, and 46% said they were discriminated against by landlords. Healthcare settings. Many trans people have high anxiety about accessing healthcare due to negative past experiences. In the last 12 months, 13% of participants were asked unnecessary or invasive questions during a health visit. Only 46% reported that their GP consistently used the correct name and pronouns for them. 36% had avoided seeing a doctor to avoid being disrespected. 17% reported that they had experienced conversion practices. A professional had tried to stop them from being trans. Justice. 1% of participants said they'd been to prison. This compared with 0.7% of Māori in the general population and 0.12% of non-Māori in the general population. 1 in 14 participants, 7%, had been detained, held in custody, arrested, or charged by police. Of those who had experienced this, 42% said they had police deliberately misgender them or refused to use their name. 53% were not given a choice of what gender of police officer searched them. 9% were harassed or assaulted by police because they were trans or non-binary. Only 8% were given a choice of a cell with women, with men, or with neither. 32% were put in a cell where they did not feel safe as a trans or non-binary person. Only 12% had access to a shower that was safe. Private life. 2/3 of trans students come out while they're at school, but of those who do, only a third feel safe to come out to their parents. 64% of trans students said at least one parent cared about them a lot, compared with 94% of cisgender students. Only 32% of transgender students felt safe in their neighbourhood, compared with 58% of cisgender students. And 59% of homeless trans people didn't contact their family to help find housing. Sexual violence. 32% of trans people reported that someone had had sex with them against their will after the age of 13. This is almost 3 times the rate of women in the general population, at 11%. Those who had experienced being forced to have sex were twice as likely to have attempted suicide in the last year. We note that both groups are likely to be severely underreporting, so the actual figures will be higher for both the group transgender people and the group women in the general population. Distress and desperation. 71% of trans people live with high or very high psychological distress. This is compared with 8% of the general population. So that's 9 times the rate of the general population. 57% of transgender students had self-harmed in the past year, compared with 22% of cisgender students. 38% had self-medicated using cannabis in the last year. This is over 3 times the rate of the general population, at 12%. All types of drug use are much higher for transgender people, except for alcohol and tobacco use. 56% seriously thought about attempting suicide in the last 12 months. 12% made a suicide attempt in the last 12 months. And 37% attempted suicide at some point in their life. That's more than 1 in 3. We know that these statistics are shocking for most people. If you want to talk with a counsellor or other mental health service, please see our healthcare services database at genderminorities.com/services near me.